Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Instagram teen accounts have built-in protections for who can contact teens and what they see. Learn more about teen accounts at instagram.com/teen accounts.
There are many medical conditions that are misrepresented in popular media, a prominent one being obsessive compulsive disorder, or OCD. Though it's often portrayed as the need for cleanliness, Dr. Emily Bailey says it's much more debilitating than what Hollywood usually shows.
OCD is really characterized by obsessions and compulsions, obsessions being unwanted intrusive thoughts that cause distress, cause anxiety, and then this compulsive piece where they're engaging in some sort of behavior to reduce the anxiety that the obsession causes.
Bailey is a clinical psychologist who treats a subtype of OCD called scrupulosity, also known as religious OCD. While it can happen to anyone, even people who don't identify with any faith, this type of OCD creates guilt or obsession around moral issues.
Oftentimes when people come into therapy and they're presenting with scrupulosity OCD, they're asking questions and really concerned about intrusive thoughts related to what if I sinned? Am I praying correctly? Did I offend a higher power? What if I did something and that's going to result in an undesired afterlife? And so scrupulosity is really asking these unanswerable questions that cause distress, right? And they come to us often not even knowing that this is their diagnosis, like what OCD is, because so often people are trivializing OCD to be just about cleanliness. So this is a completely different subtype that's really not fully understood. But the obsessions center around, am I practicing my religion in a way that I should be?
Notice how Bailey didn't single out just one religion? That's because OCD doesn't discriminate. But while it can happen in any type of faith, she has noticed that many of her own patients come from rule-driven religions, such as Christianity, Judaism, and Islam. Another assumption people make is that scrupulosity is a product of religious trauma, but that's the opposite of the truth in many cases. Jaimie Eckert, for example, had a very positive experience growing up in the Christian faith.
It appealed to me, the idea that there was a God who had created me and had a purpose for my life. And that was just something that I found very heartwarming, and it drew me even to make my own decisions. I attended a conservative Bible college afterwards, which was my choice. I was just a very naturally spiritual child. And again, most of it, I think for me, was a genuine and sincere and positive experience that only later got hijacked by OCD, because, OCD attacks whatever you love the most. Many people that I've talked to that have this, they say this is the worst kind of OCD because it's attacking what is so central to who we are as people.
Religious OCD latches onto your existing beliefs, then twists and amplifies them to the extreme.
Compulsions can look different, especially depending on what people present with. But one of the most common ones that I see is excessive prayer. So praying upwards of 15 plus times a day, asking forgiveness multiple times a day. Sometimes it involves confessing sins or behaviors that are thought to be sins. It can also actually include avoidance. So sometimes people come to me and they're actually avoiding all places of religion or reading religious text because they don't want to be triggered, right? They don't want to have to start doing even more compulsions or pray excessively or seek reassurance compulsively, right?
The signs of scrupulosity can be difficult to recognize because many faiths praise this type of devotion. However, Bailey says the line between healthy and unhealthy is drawn when it starts to negatively influence your life.
The differentiation can be difficult, but I think one of the biggest things is, does practicing your religion interfere with living your life in other ways? Does it interfere with your work? Does it interfere with your relationships, right? Your romantic relationships, your friendships? Does it cause you to stress? That's another really big component. if you feel fear or distress when practicing your religion, then the likelihood is that you may be engaging in a compulsion.
Sadly, it took Eckert years before she would realize this difference. Her OCD first began to creep in during her college years.
I would get these impressions about what I had to wear, what I could or couldn't eat, when did I need to abstain from eating. Even the quote unquote God voice was telling me who I had to marry, and of course it's somebody that I could never imagine myself being with. So I'm like, no, God, I don't want to do that.
But if that's what God wanted, that's what Eckert believed she had to do, even though she couldn't imagine a happy future with this man. Though she was eventually able to overcome this compulsion, all of these thoughts became demanding and oppressive, very unlike the God she had grown up knowing her whole life.
My understanding of God was very healthy and full of grace and very positive, and yet my day-to-day experience just started to landslide into this really strange concoction of all of these impressions that seemed like God was telling me to do things, even to the point, like when I say micromanaging, even to the point of like, I'd get impressions that if I was going from the cafeteria to the admin building, I had to walk this way instead of that way, like I would have to go the longer way. And I'd be like, well, why, God? Well, I don't know, but the impression was there. And I had to follow it because maybe something bad would happen to me, or maybe God was testing me to see if I was really in tune with his voice. And if I wasn't in tune with his voice, then what did that mean for my salvation?
These continuous thoughts began to snowball into larger questions and doubts that would get stuck in Eckert's head. Does God exist? Is my religion the true faith?
I felt like if I don't figure out these answers, my whole life is on the line. A big one for me was, whether or not God actually exists. If God doesn't exist, my whole faith is meaningless. So, like, why am I even bothering with all of this? I would hole myself up in my dorm room for like 8 hours at a time, listening to apologetic sermons about the existence of God or salvation and things like this. And it would just make me feel so good. But then a few weeks later, I would feel the need to like revisit it again and reassure myself again that those answers were correct for me.
These compulsions continued to persist, even after college when Eckert and her husband moved to the Middle East to work as missionaries.
I was working with refugees, so I had a lot of compassion fatigue going on. I had a lot of pressure on me constantly. And I had had some circumstances occur in my professional life that felt like a failure to me. And because my work was related to my religion and my church, and I worked for a church organization, it felt like if I fail professionally, I'm actually failing God.
It was during this mission trip that Eckert had a mental breakdown that included severe clinical depression and suicidal ideation. The couple moved back to America to get her help. Eckert came across the term religious OCD through a Google search and identified with it immediately. She was able to get an official diagnosis and finally receive professional help to treat the thoughts that had been torturing her for years.
The clergy don't know what to do with this. They tell you, pray harder, pray harder, pray harder, and that's going to backfire on you. The secular psychologists tend to, have a more secular approach, which I can tell you, I have so many people in my support group that have just fled from therapists, which is so sad because they're afraid that therapy is going to make them deny God. It's going to make them sin. It's going to, just push them further away from the Lord. So it is a really complicated, and I don't think any of us have perfect answers to what to do with this. But one of the things that's just been helpful for me is recognizing this is two things at once. This is my relationship with God, and that's a spiritual thing. And this is also my brain, which is a real organ that's sitting inside my head. And it needs treatment. It doesn't necessarily just need to kneel down and pray harder.
Bailey says a lot of providers either don't know how to treat religious OCD or they miss the signs altogether. And since the illness is so intertwined with someone's faith, there's a big fear that the choice is either to be healthy or keep their faith. So many just don't seek treatment. However, Bailey says that scrupulosity treatment is not at all an attack on the patient's religion.
The goal is to actually bring you closer to your faith and practice faith in a way that aligns more with your faith community and with the tenets of the faith. I always say that OCD has a very intense way of hijacking our faith and making us believe we have to do X, Y, and Z to be, a Christian, for example. That's not the case. The goal, what we really want to do is just provide them with the ability to do whatever people in their community do as a part of their normal faith practice.
And this is achieved through exposure and response prevention.
And it essentially involves exposing an individual to situations that they fear, And then using response prevention while being exposed. So what does response prevention mean? That means we're not going to allow you to engage in the compulsion, or we're going to reduce the compulsion in some way. Now, that sounds really scary, and I recognize that that sounds very intense, but patient and provider really at the beginning work collaboratively to not only understand what OCD is and how this is OCD, but we really work to lay out what would be the least distressing situation that you could possibly put yourself in where we could fight OCD just a little bit, right? We're going to gradually start exposing them to things they fear rather than throw them into the deep end of the pool without any floaties.
This helps the patients learn to tolerate anxiety and realize that they can get through the uncomfortable feelings without needing to act on the compulsion.
OCD doesn't care about their faith. OCD cares about OCD. So we may ask patients to do things like pray less. And that feels like that is the least religious thing you can do. But if you're coming from a place where you're already excessively praying and you're only communicating with your higher power out of fear, then we don't want that. We don't want to ever interfere with the relationship with God or a higher power, but we do want that connection to be meaningful and be comforting, not driven by fear.
Since the goal is to heal the OCD while keeping the faith intact, Bailey's an advocate for having a faith leader be present for this journey so that they're also able to pinpoint normal practices from OCD-driven ones.
You don't have to pick like your health or your mental health over your religion. It's hard work, but I think it's so valuable. It's such a protective factor. Religion is so important in people's lives. I would never ask somebody to leave their faith just because OCD got hard. There's so much you can overcome.
You can find more information about Dr. Emily Bailey, Jaimie Eckert, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health on Facebook, Instagram, and X. This segment originally aired September 2024. Our writer-producer is Kristen Farrah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Instagram teen accounts come with automatic protections for who can contact teens and the content they can see. Learn more about teen accounts at instagram.com/teenaccounts.